Hello, wonderful couples and individuals on your fertility journey. If you're considering starting or growing your family, you've probably come across two common fertility treatments, IUI and IVF. Today, we're diving deep into what these procedures involve, their costs, timelines, medications, success rates, emotional aspects, and more, so you can make the most informed decision possible. Let's start with IUI, or intrauterine insemination. IUI is often recommended as a first-line treatment for couples facing unexplained infertility, mild male factor infertility, or issues with cervical mucus. The process is relatively straightforward. After monitoring your ovulation cycle, a fertility specialist prepares a concentrated sample of sperm either from a partner or donor and places it directly into the uterus using a thin catheter. This increases the chances of sperm reaching the egg. The entire IUI cycle typically takes about 4 to 6 weeks, including initial consultations, ovulation tracking, and the insemination procedure itself. You may need to repeat the process for several cycles, as success rates per cycle are around 10 to 20% for women under 35 and slightly lower for those over 35. Medications are often used to stimulate ovulation. Common options include Clomid or Letrozole, which are oral medications, and sometimes injectable hormones like gonadotropins. These help your body produce one or more eggs, increasing the chances of conception. Side effects of these medications can include mood swings, hot flashes, headaches, and mild bloating. Most are temporary and manageable, but always discuss any concerns with your doctor. Now, let's talk about costs. IUI is one of the more affordable fertility treatments, ranging from $2,000 to $3,000 per cycle, including medications and monitoring. However, costs can add up if multiple cycles are needed. Financial planning is key. Some clinics offer package deals for multiple cycles, and certain insurance plans may cover part of the cost. Be sure to ask about payment plans, discounts, and what's included in the quoted price. Emotionally, IUI can be a roller coaster. The waiting period after insemination, often called the 2-week wait, can be stressful. Support from your partner, friends, or a counselor can make a big difference. Expert tip: keep communication open with your partner and your medical team. Don't hesitate to ask questions or seek emotional support. Common myth: IUI always works on the first try. In reality, it often takes several cycles, and success depends on factors like age, diagnosis, and overall health. Frequently asked question: does IUI hurt? Most people describe it as mildly uncomfortable, similar to a PAP smear, and the procedure is usually quick. Now let's move on to IVF, or in vitro fertilization. IVF is often recommended for couples with blocked fallopian tubes, severe male factor infertility, or when other treatments haven't worked. IVF is a multi-step process. First, you'll take injectable medications to stimulate your ovaries to produce multiple eggs. These are then retrieved in a minor surgical procedure under sedation. In the lab, eggs are fertilized with sperm, and the resulting embryos are monitored for several days. The healthiest embryo is then transferred into the uterus, and any extras can be frozen for future use. Each IVF cycle takes about 4 to 6 weeks from start to finish, but the process can feel longer due to the emotional and physical demands. IVF involves more medications than IUI. You'll likely use ovarian stimulation drugs like Gonal F or Folistim, trigger shots like HCG, and hormone support such as progesterone. Side effects can include bloating, mood changes, headaches, and rarely ovarian hyperstimulation syndrome, OHSS, which can be serious. Always report unusual symptoms to your doctor right away. IVF is a significant financial investment, with costs ranging from $15,000 to $20,000 per cycle, including medications, monitoring, and lab fees. Additional services like genetic testing or embryo freezing can increase the total. Financial planning is crucial. Some clinics offer refund programs or shared risk plans. Check if your insurance covers any part of IVF, and consider setting up a dedicated savings account or exploring fertility grants. Emotionally, IVF can be intense. The process involves frequent appointments, injections, and waiting periods. It's normal to feel anxious, hopeful, or even overwhelmed. Expert advice: build a support network, join online forums, connect with others going through IVF, or seek counseling. Self-care and open communication are vital. Common myth: IVF guarantees a baby. While IVF offers higher success rates, about 40 to 50% per cycle for women under 35 and lower for older women, it's not a guarantee. Multiple cycles may be needed. Frequently asked question, is IVF painful? Most people tolerate the procedures well. Egg retrieval is done under sedation, and embryo transfer is usually painless. Always consult with a fertility specialist to tailor the treatment plan to your unique needs and circumstances. Ask about all your options, including less invasive treatments or donor eggs and sperm if needed. Real-world tip, keep a journal to track your appointments, medications, and feelings. Celebrate small milestones and don't be afraid to take breaks if you need them. Remember, every fertility journey is unique. Stay hopeful, support each other, and know that your dream of a family is worth every step. Thank you for watching. If you found this video helpful, please like, subscribe, and share your questions or experiences in the comments. We're here to support you every step of the way.